In this video, we're going to go over the 6 best supplements that you could be taking for back pain. Hello, I'm Dr. Grant Cooper from Princeton Spine and Joint Center. First, a disclosure. I don't sell supplements, and no one has paid me to make this video on supplements. I'm just obsessively interested in health and wellness, and I treat people with back pain all the time. So I want to know about everything, including supplements, that might be able to help my patients. One more quick disclosure. I'd meant to make this the video about the top 5 supplements for back pain because 5 seemed to be a more round or a more common number to use for this sort of thing, but I just couldn't fairly decide between 2 of the supplements because I thought they were both so good. So just so you know, that's how we landed on the 6 best supplements. But before we talk about those top 6 supplements for back pain, let me just put 2 important disclaimers out there. First, always talk to your doctor before starting any new supplement. It's just a good idea. Supplements can interact with your medications, and just as supplements can have positive effects, they can have negative effects on your body too. So please talk to your doctor to make sure that any one supplement is right for you. And second, you need to know there is no magic pill out there. If someone promises you a magic pill or a pill that will instantly fix your back pain, just shake your head and move on. It's not real. Believe me, if that pill becomes real, I'll buy stock in it and then I'll let you know all about it. But for now, it unfortunately just doesn't exist. And with that said, there are supplements that both make sense to deal with the inflammation of back pain and also supplements that have both survived and thrived through some rigorous studies evaluating their efficacy. Okay, are you ready to get into them? I am. I'm excited about this one. So let's get going. Here is the countdown for the 6 best supplements for back pain, starting at number 6. The 6th best supplement for back pain is ginger. Ginger root comes from the Zingiber officinale plant, and it's been used in traditional Chinese and Ayurvedic medicine for literally thousands of years, as in over 5,000 years, as a treatment for a variety of ailments. So the plant really has staying power. Now, ginger has been shown to have a host of positive effects on the body. It appears to help boost the immune system and fight infections. It helps with nausea, weight loss, improves insulin sensitivity, and it improves cardiac health. And there's data that ginger may help prevent certain types of cancer. Ginger may also improve brain function. It may protect against neurodegenerative diseases such as Alzheimer's disease, multiple sclerosis, and Parkinson's disease, and fight against age-related cognitive decline. Now, ginger works better than placebo for treating menstrual cramps, and it works better than placebo for treating the inflammation and the pain from osteoarthritis of the knee. Ginger also helps to fight against inflammation and oxidative stress in the body more generally. On a chemical compound level, ginger contains compounds that inhibit prostaglandins, which are a major contributor to inflammation. Ginger seems to do this, at least in part, in a way similar to non-steroidal anti-inflammatory medications such as naproxen and ibuprofen. That is, ginger affects the COX-2 pathway as well as having other properties such as antioxidant activity. Now, while studies of ginger specifically for lower back pain are sparse, its general health benefits, coupled with ginger's proven anti-inflammatory and pain reduction effects, have landed ginger at the coveted number 6 spot on the top 6 supplements for back pain. Dosages of ginger in clinical trials has ranged from taking 170 milligrams to 1 gram 3 to 4 times a day. I'd suggest that if you're going to take this supplement that you start with a lower dosage to see how you feel on it. Now, don't take ginger if you're taking a blood thinner, as ginger is known to interact with those blood thinning medications. Also, don't take ginger if you're taking blood pressure medications or hypoglycemic agents. That is to say, and you're going to hear me say this at least 5 more times in this video alone, so bear with me, but it is important. Please talk to your doctor before starting any new supplement, as supplements can have bad effects just as they can have good effects. The 5th best supplement to take for back pain are tart cherries. Tart cherries can be consumed as tart cherry juice, though that does contain a fair amount of sugar, so please diabetics be aware of that approach. Or you can take tart cherries as a pill. I have to confess a bias when it comes to tart cherries, and that's because my wife's family happens to come from Eastern Europe. And in parts of Eastern Europe, tart cherries have been eaten for centuries to treat all sorts of ailments. and most notably to treat different kinds of arthritic pains. One look at the scores of 80 and 90 plus year olds walking easily through the forest, and you too would at least have to give Tart Cherries a second look. And that's what I did. I gave Tart Cherries a second look. And sure enough, it turns out that the research is present and compelling. Now, first of all, Tart Cherries significantly reduce pain and stiffness after exercise, and they help runners recover faster after a difficult workout. Tart Cherries have been shown to help males increase muscle strength in combination with exercise, as opposed to exercise plus a placebo. Tart Cherries seem to also improve sleep quantity and quality. They improve mood, reduce symptoms of gout, improve memory, and they seem to strengthen the immune system and help to fight infections. Now, Tart Cherries are extremely rich in anthocyanins, and they're positively loaded with anti-inflammatory and antioxidant properties. Studies have shown that Tart Cherries can be used to treat the inflammation associated with symptomatic arthritis. So, it's because of the proven efficacies of Tart Cherries for fighting inflammation and for fighting muscle pain and soreness, as well as all of the other health benefits of Tart Cherries, that Tart Cherries has just edged out ginger and landed in the impressive 5th position in the top 6 supplements for back pain list. So congratulations to Tart Cherries, and to all of Eastern Europe for that matter, for being a little ahead of the curve on this one. Now, again, if you're taking a blood thinner, or if you're on any blood thinners, please don't take Tart Cherries or drink the concentrated juice without talking to your doctor. If you're a diabetic, as I mentioned before, beware of the sugar in the Tart Cherry juice. And as an important general rule of thumb, again, please talk to your doctor before starting any new supplement because, like we said, supplements can have bad effects, they can interact with medications, etc., just as they can also have positive effects. The 4th best supplement to take for back pain is one that's held up fairly well under research scrutiny. That is to say, it's been shown to be better than placebo for pain and debility in people with osteoarthritic pain. This supplement is called Boswellia Serrata. Boswellia Serrata is a tree that's native to India, Africa, and the Arabian Peninsula, and it's been used in traditional medicine for thousands of years, most notably in Ayurvedic medicine. Now, Boswellia appears to prevent the formation of leukotrienes in the body, and leukotrienes are a very significant part of the body's inflammatory response. Boswellia has other potential health benefits as well, including it's been shown to improve symptoms in asthma, it's helped to treat autoimmune disorders such as rheumatoid arthritis, as well as inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. Boswellia may even help to fight advanced breast cancer cells, and it may be helpful fighting other forms of cancer as well. Boswellia has been found to increase mobility and to decrease pain in patients with painful knee osteoarthritis. It's because of all of these demonstrated benefits in treating arthritic pain and debility, coupled with Boswellia's impressive anti-inflammatory effects, as well as all the other potential health benefits, that has landed Boswellia Serrata as the 4th best supplement to take for back pain. Dosages vary, but the Arthritis Foundation suggests taking 300 to 400 milligrams 3 times a day of a product that contains 60% boswellic acids, and that seems a pretty reasonable recommendation. Of course, please talk to your doctor before starting any new supplement. Boswellia can cause stomach upset just like any other supplement can, and if you take it with other anti-inflammatory medications, it might reduce the effectiveness of those other medications by competing for the same pathways in the body. So I said it before, and I'll say it at least 3 more times, and it's not just for medical legal reasons that I'm saying it, although it is that too, but it's just also an important fact. Supplements can be good, they can be very good, but they can also cause problems. So please talk to your doctor before starting any new supplement. The 3rd best supplement for back pain also has an impressive amount of research to support its usage. Bromelain is a mixture of enzymes that are found in one of my favorite tasting tropical fruits, pineapples. Pineapples. Bromelain has been used to improve cardiac function, reduce blood pressure, improve lung function, improve skin health, alleviate swelling and congestion from chronic sinusitis, reduce the inflammation associated with colitis, reduce healing times after surgery, and may even have the potential to reduce cancer cell growth. Now, in one blinded German study, bromelain was shown to be as effective as diclofenac, which is a non-steroidal anti-inflammatory drug that's sold under the brand name of Voltaren, in treating the pain, stiffness, and overall physical function of patients with symptomatic hip osteoarthritis. This finding has been replicated for bromelain for other joints in other controlled studies. Bromelain has also been shown to reduce muscle soreness after intense exercise. Bromelain is believed to work in much the same way as anti-inflammatory medications such as diclofenac, ibuprofen, and naproxen as a COX inhibitor. The overall health attributes of bromelain, in combination with bromelain's proven effectiveness to be comparable with non-steroidal anti-inflammatory drugs for osteoarthritic pain, and also for bromelain's ability to reduce muscle soreness, puts bromelain at number 3 on the best supplements for back pain. Of course, further clinical studies to establish the extent of effectiveness for back pain and the exact dosage would be helpful. And if they do become available, I will certainly report back to you about them. In the meantime, a typical dosage of bromelain has been 200 milligrams taken twice daily. Again, talk to your doctor before starting any new medication. As I said, bromelain is thought to work in much the same way as non-steroidal anti-inflammatory drugs like Advil and Aleve, so it stands to reason that it could have similar side effects and risks. As always, I love cowboys and cowgirls, but please, when it comes to your health, don't be a cowboy or cowgirl, and please don't take unnecessary risks. Talk to your doctor before starting any new supplement. The second best supplement for back pain is omega-3 fatty acids. I imagine most of you have heard of omega-3 fatty acids. Omega-3 fatty acids are basically the healthy fats in your body, and they're thought to do all manner of good things for your health, including improving bone and joint health, improving sleep, improving eye health, reducing depression, reducing anxiety, reducing heart disease, reducing symptoms of ADHD in children, reducing asthma in children, improving sleep, improving blood sugar, improving skin health, reducing belly fat, reducing overall inflammation, improving nerve health, and reducing pain, including pain from menstrual cramps and from migraines. Also helping autoimmune disease, possibly improving symptoms from schizophrenia and bipolar disorder, and maybe omega-3 acids might even help to prevent age-related mental decline, such as an Alzheimer's disease. Some studies have also suggested that omega-3 fatty acids might prevent certain cancers. That's a lot of potential health benefits for omega-3 fatty acids. One study in 2005 compared omega-3 fatty acids with NSAIDs for neck and back pain and found that omega-3 fatty acids worked as well as NSAIDs. Omega-3 fatty acids are not a panacea for back pain, but there's reason to think that they may work as well as over-the-counter anti-inflammatories such as Advil and Aleve, at least for some people. And as we just said, omega-3 fatty acids carry many other potential health benefits, while over-the-counter non-steroidal anti-inflammatory medications such as Advil have a host of side effects and potential complications such as bleeding ulcers, high blood pressure, and kidney problems. Because of this disparity and because of the additional overall reduction in inflammation that we see with omega-3 fatty acids, in addition to working on neck and back pain in particular, omega-3 fatty acids have landed at the very prestigious number 2 spot on the top 6 best supplements for back pain list. Congratulations to omega-3 fatty acids. Now, one way to increase your omega-3 fatty acid intake is with a healthy diet. Small cold water fish such as cod, salmon, sardines are a great source of omega-3 fatty acids that have relatively smaller amounts of mercury as compared with your bigger fish such as swordfish and shark. Nuts and seeds such as flax seeds, chia seeds, walnuts, these are also great sources of omega-3 fatty acids. Supplementation is another great way to increase your omega-3 intake, of course. Dosages vary, but about 1 to 3 grams a day, depending on how much you already get through your diet, is about right for most people. Now, as good as I think omega-3 fatty acid supplements are, and I personally do take them, there are potential downsides to omega-3, such as bleeding, that can occur with them. Also, taking over a gram per day has been associated with an increased risk of atrial fibrillation, so you have to be prudent about taking this supplement just like with taking any other supplement. And again, please talk to your doctor before starting any new supplement, including omega-3 fatty acids. And now, here we are. We've arrived at the #1 best supplement for back pain. I feel like there should be a drum roll. Can we put a drum roll in post-production? I guess I'll find out. Okay, here we are. The #1 best supplement for back pain is curcumin. Curcumin, a superhero supplement, is a biologically active polyphenolic compound found in turmeric. Turmeric is the very popular spice found in many Asian countries. Turmeric has been used as a therapy in Ayurvedic and other medicinal practices for thousands of years, literally 4,500 years. Curcumin is thought to improve cardiac health, reduce the risk of cancer, reduce the risk of diabetes, reduce the risk of neurodegenerative disorders such as Alzheimer's disease, reduce the risk of autoimmune conditions, help with osteoarthritis, neuropathies, anxiety, depression. And in one 2010 study, the authors even postulated that because of its inhibition of NF-kappa B and the mTOR signaling pathway, curcumin may be able to slow down aging itself. When talking specifically about back pain, curcumin has been shown to work as well as non-steroidal anti-inflammatory medications for the treatment of pain and inflammation. It is this combination of proven anti-inflammatory effectiveness, wide array of potential health benefits, and curcumin's ability to reduce pain and debility comparable with non-steroidal anti-inflammatory drugs. In fact, in one study, curcumin improved pain and function better than a non-steroidal anti-inflammatory drug. Anyway, it's all of these factors combined that have landed curcumin at the #1 spot on the best supplements for back pain. While curcumin is found in turmeric, it's not present in particularly high dosages in turmeric. In fact, it's just about 3% by weight of the turmeric. So it's very hard to eat enough turmeric to get the concentrations of curcumin that have been studied in clinical trials. With that said, there's nothing wrong with increasing turmeric in your diet, and turmeric may even have other health benefits outside of just the curcumin, not to mention being very tasty on some dishes. Curcumin supplements should include piperine in the supplement. Piperine is an alkaloid present in black pepper, and importantly for our purposes here, is that piperine increases the absorption of curcumin by 2,000%. Supplements often list this as biopyrine, which is a regulated black pepper extract containing 95% piperine. So what dosage of curcumin should you take? Well, studies on curcumin typically involve patients taking between 500 milligrams and 2 grams of curcumin a day. As always, talk to your doctor before starting this or any new supplement. This is a supplement that I take as well, so obviously I'm a fan, but you have to look at the other medications you're taking to make sure there's no interactions, and also look at your whole health profile to decide if this is a good supplement for you to take. So again, and for the last time in this video, please talk to your doctor before starting any new supplement. I hope you found this video useful, and if you've enjoyed it and if you've learned something from it, then please remember to like this video, share it with a friend, and please consider subscribing to our channel. Also, please, if you've used any of these supplements or if you've used other supplements for back pain, then please, would you let us know your experiences in the comments section? I would love to hear about them. And as always, if you have topics that you would like for me to cover in a future video, or if you have any other comments, then please leave a comment or a suggestion in the comments section. I wish you the best of health. Thank you.